Hi, my name is Katie Campo. I'm going to be doing the head-to-toe assessment on Taylor Schneider, who is also a nursing student. Taylor, do you give verbal consent?
Yes.
Okay, so before we begin, I'm going to introduce myself as Katie, her nurse. I'm going to identify the patient with 2 different identifiers, explain the procedure, and wash my hands. I'm first going to start with patient positioning. So she is sitting upright. She looks to be like a very healthy female, and she is well groomed. Her hygiene is good. She is smiling right now and relaxed, and her mood is appropriate for what we're doing right now. Can you state your name for me, please?
Taylor.
About what time it is?
It's about 11.
And where we are?
We're at the dorms.
And then what we're doing here today?
Head-to-toe assessment.
Okay, so Taylor has answered everything appropriately. She's making eye contact with me, so she is alert and oriented ×4. And also noting that her speech is clear and articulate. Are you in any pain today? And if you are, can you rate it on a scale of 0 to 10?
No, 0.
Okay. So since she states she's in no pain, I'm going to move on to the next part, which is assessing her radial pulse. So just by feeling for a second, it feels to be a regular rhythm. So I'm going to count for 30 seconds and then multiply by 2. Okay, so after counting for 30 seconds, I got 30, and then so I'm going to multiply by 2, which makes 60, and that falls within the normal range of 60 to 100. Her rhythm was regular, it was elastic, and it was a 2+. So next I'm going to assess her respirations. So just by observing the patient breathe, her pattern is non-labored. She has a depth of about 1 inch, and she has a regular breathing pattern. So now I'm going to have her turn to the side so I can assess her rate. So just by observing her for a minute, she seems to have a regular respiratory rate, so I'm just going to count for 30 seconds. Okay, so I counted 10 respirations in the 30 seconds, so I multiply by 2, which makes 20, and that falls within the normal range of 12 to 20 breaths per minute. Okay, so now I'm going to take her blood pressure. So is there any restrictions why I would not be able to take blood pressure on a certain arm?
No.
Can I ask what your normal blood pressure usually is?
120 over 80.
Okay. So I'm going to take the blood pressure on her left arm. Okay, so I got 118 over 62, and that falls within the normal range of 60 to 80 for diastolic and 90 to 120 for systolic. Okay, so now I'm just going to observe her head. So just by looking, it is round and erect and midline. So now I'm going to observe her face at rest and with movement. So at rest, the corner of her eyes are symmetric with the top of her ears, and her nose is midline. Can you smile for me, please? Okay, so after smiling, her nose is still midline, and her eyes are also still symmetric with the top of her ears. So now I'm going to assess for perla. Pupils equal, round, and reactive to light and accommodation. So I'm just going to have you look over my shoulder, and the first thing I'm going to do is measure your pupils. So just by measuring, it looks to be about 4 millimeters, and they're both the same size and both round. And so now I'm going to do reactivity to light, indirect and direct light. So I'm just going to place my hand here and just keep looking over my shoulder. So the first thing I'm going to do is shine direct light into her left pupil and observe for constriction. So her left pupil did constrict with direct light shown in, so I'm going to do her right. And also I have observed right pupil constriction with direct light shown. So now I'm going to shine light into her left pupil and then watch for her right pupil to constrict. Okay, so her right pupil constricted when light was shown into the left eye. So now I'm going to repeat with the right eye. Okay, so her left pupil constricted when light was shown into the right eye, so she is good for indirect and direct light reactivity. So now I'm going to test for accommodation. So I'm going to hold my pen light here, and I'm going to just have you look at the top of it, and I'm going to move it towards your nose and just focus on the top of it, okay? Okay, so by observing her pupils, they constricted also with accommodation. Okay, so now I am going to inspect her arm. Okay. So by looking at both sides of her arm, she seems to have a nice beige skin tone with some pink undertones. I'm not seeing any open areas, any bruising, anything like that. Then I'm going to observe for primary lesions. So it looks like she does have some primary lesions in the form of freckles. They're evenly scattered. They are flat. And then now I'm going to palpate for edema, and also I'm going to feel for some temperature. So just let me know if you feel any pain or tenderness while I'm palpating, okay? Any pain or tenderness at the joint? Pain or tenderness here? Okay. So while also palpating, I felt no edema also, and so now I'm going to just feel for her temperature. So her skin temperature is a nice warm temperature, and her fingers are a little bit colder, but that is normal finding. Also, she has no inflammation or redness on her arm. Okay, so now I'm going to observe her chest. So just by looking at the front of her chest, her anterior, and then also her posterior, and just palpating, it is even and flat. So now I'm going to do the AP to transverse ratio to measure. So I'm going to measure right here. Okay, so for her AP trans ratio is 2 to 1, which is appropriate. So now I'm going to auscultate for lung sounds on the anterior and posterior side. Okay, so starting with anterior. So every time I move my stethoscope, I'm going to have you take a deep breath, okay? And I'm going to end with mid-axillary. so her lung sounds were clear bilaterally and through all lung fields on the anterior side. So now I'll have her turn around and I'll do the posterior. So again, with every time I move my stethoscope, I'll have you take a deep breath. And I'll end with mid-axillary. Okay. So her lung sounds were clear bilaterally and through all lung fields. So now I'm going to auscultate through her heart sounds. So I'm going to start with the aortic, which is the second right intercostal space. Okay, now I'm going to do the pulmonic, which is the second left intercostal space. And now Erb's point, which is the third left intercostal space. And now the tricuspid, which is the fourth left intercostal space. And then ending with the mitral, which is the fifth left intercostal space, mid-clavicular line. Okay, so her heart rhythm was regular, and I heard S1 and S2 throughout all the heart positions, and no extra heart sounds such as S3 or S4 were heard. Okay, so now I'm going to do my abdomen assessment. So I'm going to have you lay down, please. So I'm going to drape her appropriately so we can see all four quadrants. Just going to put this down. Okay, so first I'm going to start with inspection. So just by looking across, her contour is flat. All four quadrants are symmetric and her umbilicus is midline. And I don't see any lesions present on the abdomen. So now I'm going to start with auscultation. So are you experiencing any pain in the abdomen today? Okay, so if she was experiencing pain, that would be the quadrant that I would end in. But I'm going to begin in the right lower quadrant at this time. Moving clockwise throughout. Okay, so after listening, she has active bowel sounds in all four quadrants, and I heard about 8 to 10 bowel sounds per minute. So now I'm going to palpate the abdomen, and so if you feel any pain or tenderness at any time, please let me know. So I'm going to do 2 spots in each quadrant, starting with the right lower. Any pain or tenderness? Any pain or tenderness? Any pain or tenderness? None? Okay. So the patient does not have any pain or tenderness in any of the 4 quadrants. Her abdomen was soft, not rigid or hard, all normal findings. So now I'm going to move on to her leg assessment. So I'm going to drape her. So I'm going to be inspecting her right leg. So by looking at the top and looking underneath, I'm not noticing any inflammation or redness. She has a nice beige skin tone with some pink undertones. I'm not noticing any open areas, any bruising. So now I'm going to observe for some primary lesions. So she has some flat pinpoint freckles in the form of primary lesions. They are not raised. There is no drainage. They're not inflamed. They're pinpoint and round and look to be a light brown color. So now I'm going to palpate for edema. The patient has no edema. And now I'm going to palpate also for pain and tenderness. So if you have any pain or tenderness at any time, please let me know. Any pain at the knee joint?
Okay.
Any pain here? So the patient, she states she has no pain, so now I'm going to feel for temperature. So her right leg is warm, a nice temperature, and her toes are a little bit cooler, but that is also a normal finding. Okay, so now I'm going to assess for numbness and tingling. So are you experiencing any numbness and tingling?
Mm-mm.
No, the patient states no numbness and tingling. Okay, so I'll have you roll back down your pant leg. And so now I'm going to assess for dorsi and plantar flexion. Okay, so for her right leg, I'm going to have you point your toes up towards the ceiling. Okay, good for dorsiflexion, and now I'll have you point your toes towards the carpet. All right, she's good with plantar flexion also. Now for her left leg, so can you point them up? Okay, good dorsiflexion, point them down, and also good with plantar flexion on both feet bilaterally. Okay, so now I'm going to assess for pulses. Okay, so first I'm going to start with her dorsalis pedis. So on her right leg, I'm feeling it's about a 2+ and it's a regular rhythm. And now I'll do her posterior tibialis. Okay, it is also a 2+ and a regular rhythm. And now I'm just going to inspect her ankle and her foot and in between her toes. So I'm not noting any decubitus on either the right or the left. Her feet are in good condition. Okay, so now I'm not noticing any IV, any catheter. She's not hooked to supplemental oxygen. So now that I'm done with my assessment, I will position her for comfort, bend the lowest setting, side rolls up ×2, call light within reach, and items within reach.